everyone. Thanks for being here. I'm Barbara Levy. I'm an OBGYN. I've been in the women's health business for a little over 40 years now, and I'm a huge advocate for innovation and new and exciting things in the women's health space. I've always been an advocate for cryoablation, and so I'm just thrilled today to introduce you to Brooke.
Hi, I'm Brooke Bollum. I'm just a mom and I'm the patient. And then Dr. Schafer-McLean is my OBGYN.
Hi, I'm Dr. Rhonda Schafer-McLean. I'm an OBGYN in Bismarck, North Dakota. I am a big champion for procedures that might occur in clinics just because we live in a really rural space and everybody doesn't have the opportunity for larger health systems or oftentimes hospital-based care. So we've been really privileged to partner with teams that have helped us to bring technologies to women in rural North Dakota.
Awesome. Brooke, let's start out. Can you just tell us about your period symptoms and why you decided to talk to Dr. Schafer-McLean about what you were experiencing?
Dr. Schafer was actually my OB for my last child. And it's just like I had super heavy periods. I had cramps. It was really bad. It was just miserable. I work outside, so for me, finding a bathroom wasn't exactly the easiest thing for me. And there was just, a lot of cramps, a lot of, bleeding very heavily, and then a lot of like back pain and that sort of stuff.
Did it interfere with work? Did you have to leave work? And tell us a little bit about how it impacted your life.
Every day, every cycle, I would have to take a spare set of clothes just in case. I would have to make sure I packed my special bag to take with me. And I'd have to watch, especially on my super heavy days, which was about three, sometimes 4 days a month. I would have to make sure I went to the bathroom every hour. And when you work outside, that's not always possible.
And Dr. Schafer-McLean, can you kind of walk us through how you approached Brooke when she came in to see you? How did you figure out what was going on with her?
Sure. I mean, I think, it's a pretty classic story actually. A woman comes in and says, hey, I'm kind of in this phase of my life where I'm done having children and I've had a permanent method of birth control applied to myself or my partner for, years. And gosh, these periods are just too much. Is there something we can do? But, dun dun dun, I don't really have time to take out of my life for hysterectomy. Is there anything else? And of course, you talk about all the options, the pills, the IUDs, the patches, the rings. And I think at the end of the day, women really would just prefer something a little bit more definitive and a little bit more likely to get them to that point where they feel like, okay, set that aside. It's really not impacting me anymore. And so, we talked, of course, about all the options, but for Brooke, it was really, really clear she was up for a fairly definitive solution and didn't have a lot of time to spare.
And what other workup did you do to decide that she was a good candidate for?
Absolutely. So typically, we'll do a full physical H&P, just make sure that everything is up to date. In my practice, I like to be certain that Pap smear is current and benign. We do an endometrial biopsy to be certain that there's not some kind of aberrant or early abnormal tissue that's growing inside of that uterus actually contributing to the blood loss that the patient is feeling. I'm a pretty strict advocate for assessing for any genetic risks. So, for example, if Brooke had a really strong cancer history in her family, maybe it would be better for her to have a surgical intervention rather than something just to, allay this bleeding. We do a series of blood labs just to make sure we're not up against a serious anemia or some kind of an infection in the moment. And then finally, ultrasound is really important, just so there isn't some other kind of pathology that we can find or see that would preclude us from having success with this procedure or sort of force our hand in a different direction.
So, Brooke, can you talk a little bit about why you chose an ablation as opposed to, let's say, some hormonal treatment or an IUD?
I actually have factor V, which is clotting disorders. So for me, a lot of the hormone stuff was not an option. And then also, I had talked to people who had had different types of ablations, and a lot of them, like they were like my mom, she had the burning one, and it didn't work for her at all. Like she said, it was the worst experience of her life. But and then I had a coworker who had and the same ablation, and she said it was the best thing she ever did. Um, and yeah, it was just kind of talking to people and their experiences. It kind of helped me make my decision between that and talking to Dr. Rhonda. It was, yeah, it was, it was perfect for me.
Dr. Schafer-McLean, how do you describe the cryoablation or the Cerene procedure to patients?
Typically I'll talk to the patients about, that inside layer of your uterus that each month we shed, that we have the ability to ablate or burn or freeze that depending upon the type of ablation method that we're choosing. Obviously with Cerene, it's the cryo or the freezing ablation. And so we talk about how that coldness, being from North Dakota, the cold has a little bit of an asterisk in our hearts and minds because we live with it in the day to day. So everybody kind of understands frostbite, I suppose. Um, so, we talk about how that burns down to this particular layer in the uterus, and it really stops the ability for that layer to regenerate or do something to make that period tissue come back. Um, we talk a lot about how, it's a satisfaction based assessment when we talk to our women that have had the procedure. Not necessarily that you'll never bleed a drop of menstrual blood again, but that in fact women say, gosh, I'm happy I did this. There's no way we can guarantee that you won't bleed from your uterus unless you don't have a uterus. But, the reality for us is sometimes we just don't need that big of a sledgehammer to get the job done. We just need to knock it down to something that's pretty manageable monthly. And time and again, I just hear from patients, wow, I didn't even know that was an option. And, here it is right here in my own clinic. And we're just so grateful for the technology. It's extremely, extremely, helpful in getting women back on track.
You mentioned site of service, that doing it in your clinic is a big deal. And I know you mentioned that you have experience with both heat ablations and cryo. Can you talk to us about the site of service as a part of the decision making?
Absolutely. For women with a permanent method of birth control, like a tubal ligation or long-term partner with a vasectomy, or committed partner, I guess even is a better kind of term, with a vasectomy, we're able to, talk about doing this in the clinic. And it's a wonderful option. It's a very easy day procedure. In the past, I've been really, really invested in ablation, but heat ablation, because it was the technology that we had, and it's a very good method. I will say with the cryoablation, the pain is phenomenally less. Like we've really backed off on our pain protocol because in the past we've given an anti-anxiety bit of medicine, a narcotic level pain medication, and then an injectable form of ibuprofen. And that's really been pretty successful for folks with paracervical block, where we put lidocaine right next to the cervix. And what we're finding with the Cerene cryoablation is that those things are just all but they're not necessary. Actually, we can really just do the procedure. So it really puts it out in the front for me as a method of clinic being the site of service for the cryoablation. I mean, it's almost like getting a pap smear. It's hardly anything more to most women, and that's really impressive.
Brooke decide that. We're going to talk to Brooke about what her experience was.
Love it. Love it.
Yeah, because that's really from the horse's mouth. And Brooke,
Absolutely.
you said that you had a friend, or your mom had said it was the worst experience of her life. So were you scared? Like, were you afraid that this would be a horrible experience? Or can you talk to us about what you were thinking?
With my mom, that was, you got to think, 30 years ago. So everything's changed. So I really wanted, after talking to my work wife, it's my coworker, she had just had it done like 5-6 years ago. And she said, yeah, she doesn't regret it at all. So it was kind of knowing that she was back to work within 2-3 days. So it was, yeah, things had changed. So I kind of I had to do some research.
Mhm. So what made you decide to go with Cerene and the cryoablation?
Just talking to Dr. Rhonda on what was best for me. And I guess I knew that by kind of doing my research too, that it and talking to Dr. Rhonda, that it when you do the burning one, it basically closes it off.
Mhm.
Whereas this way we could still go back in if we needed to. And that kind of made it an easy decision for me.
Great. Dr. Schafer-McLean, were there risks that you discussed with Brooke about the Cerene procedure?
Sure. I mean, with all procedures, we talk about, risk of failure, of course. It just doesn't work for some subset of the people. We talked about there being pain. You talk about infection. When we do anything in the uterus, one of the things we think about is perforating or poking a hole in that uterus. Again, pretty low risk because of the way that, the technology has been produced, but it can happen. So we talk about those things.
Right. So let's go to the day that you came in, Brooke. Were there any specific instructions or medications, Dr. Rhonda, that you gave Brooke in advance of the procedure?
Yep, absolutely. We tend to use a pain protocol that I think I've alluded to patients and Serene in general. We were able to back that down quite a bit from other forms of ablation. So we do still offer a partial dose of narcotic and an intramuscular injection of NSAID or something like an ibuprofen in an injectable form, and then we have typically given a little bit of anti-anxiety medicine. And sometimes we'll do that if a person is, pretty scared or pretty worried or that, type of personality. So we do that. And then, there's the option to give an antibiotic just prophylactically before any kind of procedure when you look inside of the uterus. And that's some of the discussion that we do have. Some folks are absolutely opposed to some of those choices. And, we have some flexibility there.
So, Brooke, can you walk us through what happened the day that you had the treatment?
I took the meds as was directed, brought the ones that I needed to in, and Rhonda's office is just so relaxed. It's just you walk in there and it just feels like you're at home. I just love the feel of her office. I think I spend too much time there sometimes, but but yeah, no, it's was just very relaxing. They checked me in. I waited a few minutes and they took me back and we got started.
Tell us what the experience was like for you. Were you experiencing much in the way of discomfort during the procedure? Were you really anxious? Kind of talk us through the procedure. How long did it take?
I was very relaxed. Maddie was phenomenal. Was my nurse. Just absolutely love her. She was just chatting with me and it was very relaxed, very calming. I sat and just, yeah, I just sat on my phone while I waited and the meds took effect and we were ready to go. Pain wise, there really wasn't. I mean, little uncomfortable, but nothing I haven't experienced worse with my periods. And so
Brooke, how about after the procedure? How were you feeling?
very still relaxed. I was able to get dressed and walk out. My dad was waiting for me and drove me to lunch.
Were able to go to lunch right after the procedure.
Yeah, it was, yeah. Dad was pretty, he's like, really?
That's pretty awesome.
Mhm.
So, Dr. Schafer-McLean, can you tell us what expectations you set with Brooke about her treatment and her recovery and what to expect?
Absolutely. In general, we expect women to have a pretty comfortable procedure. We work pretty hard at that, both, with medical and kind of the fluff and the bouge that can come with a really nice clinic procedure if you do it well. And timeline, we usually say you're going to spend about 2 hours total in the clinic. By the time we do any of the pre-medication, I think we could shave that back as we get deeper into this cryoablation because we don't need the pre-medication. So probably can be done in less than an hour, to be perfectly honest. Um, and then for the actual procedure of it, it's minutes. It's simply minutes that it takes to do the procedure. And I would say the discomfort level across the board is maybe 2 to 4 maximally for people, and it'd be a rare 4, I think, for people. And so we kind of share that with them, that it shouldn't be too bothersome. We expect them obviously to get up very, very quickly after the procedure and be able to go home and have a normal evening. We do tell them that sometimes, you prefer your heating pad in the evening. We do give one extra pain medicine in case they would need it. Otherwise, we just suggest ibuprofen or acetaminophen, Tylenol, that's okay. We have them anticipate that they may or may not get another period. It may or may not be heavy. It may be continual spotting. We expect by about 3 months that things should be starting to really shape up towards something that is their final form, but have patients anticipate that it could take out to 6 months before we get to final form.
So, Brooke, walk us through what you experienced like that evening and then for the weeks and months afterwards.
That evening, after lunch with Dad, I came home. I took a nap. Kids came home from school, and I pretty much did everything I normally do.
You were back to normal
I was
activities?
completely back to normal. Yeah. I had the following day off, and then I was back at work walking 20,000 steps a day. Yes, I was back within a day.
And did you have any complications? Anything
No,
that you
I
experienced?
didn't even need to have, I just panty liner. That was it.
And then what about your next period?
I have not had one.
How awesome.
Hmm.
How awesome. So if you were going to describe this experience, describe Cerene to your friends, to your family, what would you tell them?
To do it. Actually, I had a coworker is like, she was complaining about this same exact thing, and I said, "Oh, honey, I gotta tell you what I did." And she's like, she's done having kids, and she literally was. I said, honestly, it was the best decision I ever made, and find out if your insurance covers it, if that's what you're worried about. But most of them will, and I just told her, I said, it was so worth it. I said, I was back to work within a day. I said, I haven't had it since then, and we're, what, 3 months out, roughly?
That's terrific. So, Dr. Rhonda, how has Cerene helped you do more for your patients and your practice? Talk to us a little bit about how the availability of cryoablation has changed things for you.
Oh, it's just outstanding. I mean, anytime you can take a problem that sidelines a woman for, even a day, but usually it's 2, 3, 4, 5 days a month, and you can make that go away or go to something so manageable with an outpatient procedure. I mean, it's a gift, it's just something that we can make happen so easily, and we don't make a huge production about delay of care or service because you just take the next available clinic spot. You don't get any haggle or hassle from the insurance companies about prior authorization. We just have been able to just turn it around for women. And, one of the things I think is the hardest is getting that information to women, to say, this is out there, it's an option. You don't have to be miserable every day of the month or every period of your life. Just make it go away because you're done having babies. Just make it go away. And so, yeah, really hopeful that we'll be able to continue to kind of project that to women who aren't pathologically affected by their periods and just quite inconvenienced. Those people count for this too.
Brooke, is there anything else you want to share?
I would recommend it for anybody who's in my position, especially if you can't take the hormones. It's an awesome option. And I wasn't ready for the hysterectomy, so yeah, this was my best option.
Terrific. Dr. Schafer-McLean, anything else you'd want to share?
The other site of service for this particular procedure obviously can be done in the OR as well. There's a huge subset of the population that doesn't have a permanent method of birth control. And it is very, very appropriate to say, okay, let's decide to get me that permanent method of birth control with the tubal ligation or removal of the tubes. And then let's do the ablation at the same time while I have anesthesia. It really adds no downtime to the procedure and, just knocks this out of the park. And again, it's a really, really easy, even operative procedure because you're only down, that day or two and through the weekend. And most people can go back to work even just with a few days post-op from a tubal and ablation. They can go back to their normal life pretty darn quickly, and it's a well-covered service. So I just am hopeful that we'll continue to get the word to women that they just don't have to keep this up. They can say, I'm out. I'm tapping out of this. I don't want it anymore.
We should make an emoji that says no suffering.
Seriously.
Well, I just want to thank you both so much for taking your time and for sharing your experience with us.
Absolutely.